Okay, so this class is an OET reading class, and we're going to talk today about part A. We're going to talk about text analysis because it's one of those parts of the exam that's a bit tricky. And I'm here with a number of doctors. We're live actually on Facebook, guys. Can you see my document here? Can everyone see this? Hopefully you can.
Yeah,
Yes.
we can see.
Fantastic. All right, so this is what we're trying to do today. We're going to basically, we'll talk about why we analyze texts at the start of reading part A. Oops. Then I want to give you a sort of very slow demonstration of analyzing for text. Those ones will be easy, but we can all do it together and you can ask me questions at this stage. We can discuss timings and stuff. Last thing we're going to do today is we're going to try and get through 12 texts. So that would actually be 3 mock tests, wouldn't it? There'll also be small, like a few questions after each set of analysis. So there's a lot of stuff we're trying to do today. Let's start though with a quick game. We're going to play my scanning game, guys, just to warm up. In the scanning game, I say a word and you guys just need to find the specific word that I say, okay? So for example, if I say maxilla, what is the word before maxilla in this text? Can you find it? Yeah, it's here, right? So in this game, you've got to find the word and tell me the word before the word that I say. So for example, if I say Ewing, you will all say
Comma. Tumor.
the word before? Ewing?
Tumor.
Tumor. Okay, fantastic. Now let's have a 5-second countdown as well. So you can't say anything for 5 seconds. All right. So no speaking for 5 seconds to give everyone a chance to find the word. Very useful practice this for reading part A. Okay, find the word before metastatic. 5, 4, 3, 2, 1. Metastatic. Rarely or and. Nice. Okay, it should take you about 5 seconds to find a word. Okay, find me the word before bone. 5, 4, 3, 2, 1. Bone.
D.
Yeah, the. Okay. Yeah. Find me the word before surgical. 5, 4, 3, 2, 1. Surgical.
Wide.
Yeah, good. Chara, you've got that there as well. Find me the word before absent. 5, 4, 3, 2, 1. Go.
Clinically.
Ooh,
Yeah.
Clinically. Last one. Find me the word, please, before fibrous. 5, 4, 3, 2, 1. Fibrous.
Include.
Yeah, very fast. Okay. Now we're going to change it to synonyms. So you're going to search for synonyms here really quickly in the exam, right? Let's imagine you're in the exam and your key word from the question, your key word is, I wrote some of these down today. The key word is usual. 5,
Common.
4, 3, 2, 1. Yeah, common. Right, that's a synonym of usual. They have a very similar meaning. Okay, find me the synonym for jaw. Jaw. 5, 4, 3, 2, 1. Mandible. Okay.
Yeah.
Find me a synonym, please, for of teeth, relating to teeth.
Dental.
Yeah,
Dental.
there we go. Okay, this one's a tricky one. You've got 5 seconds. Okay, find me the synonym for implies. 5, 4, 3, 2, 1. Implies.
Involve. No. Ooh.
You know, in reading part C,
Effect.
implies. Implies.
Jest.
Suggests. Okay, that was a tricky one. Find me a synonym for go inside, please. Go inside. 5, 4, 3, 2, 1. Go inside.
Invasive.
Invasive. Yeah, there we go. All right, so find me a synonym for, last one, compound. 5, 4, 3, 2, 1. Compound.
Composites.
No.
You guys are very good. Okay, so why is this useful in the exam, fella? Why are we playing this game?
Because sometimes the question they are not using the same words as in the text. They're using the synonym.
Yeah, so usually, guys, we have a question in the exam, and we have a word that we think is important, and we need to find it in the text. Okay, so that's why you should practice this with friends. Okay, so let's start the class now. We want to start off with, why do we analyze texts? So this is a slightly different thing now. In OET reading part A, okay, it looks like this, doesn't it, guys? This is OET reading part A. How many texts do we have in the exam?
4.
There you go. 1, 2, 3, 4. And how much time do we have, Mirella?
Sorry?
How much time in total do we have for part A?
For all the, like 15 minutes.
15 minutes. And how many questions? Muataz, how many questions in total?
22.
42.
No.
42 for the whole exam, yeah, but in part A?
It's 20.
Or 24.
I think it's, how
It's
many is it,
20.
fella? It's
One,
20, right? 20.
24.
No, that you're thinking of listening, okay? It's a slightly more in listening age. But
Listening
this
is
is less.
24.
Okay, so
Reading is 20.
how much time should I spend analyzing the texts? Let's start with that. How much time in the exam?
2 minutes.
2 minutes.
And a half.
About 2
About
minutes.
2 minutes. And when do I do it?
In the beginning.
In the
At the start.
beginning.
Okay.
Before.
So now here's the key question. Betul, could you say hello?
No.
Why do we analyze the text at the start?
Because understanding.
To understand. I like that one. Tell me a bit more though. What are we trying to do? Well, how does that help us? Can anyone help her? To understand them?
Main idea.
So
and
differentiate
concept.
the four
Actually,
texts.
Know about
to help
know
you
the main idea.
differentiate.
Yeah, so Fella and Abani have got it. So the answer is to differentiate. Okay. What does that mean, to differentiate?
Sorry.
Differentiate. Give me a synonym, guys, for differentiate.
Sorry.
Separate.
Separate, right? So what we're trying to do, just to show you a visual example of that, is we're trying to differentiate these texts here from each other. So this one, oops, this one here, this one is different. Let me just try and do this again. 1 second. There we go. This one here, guys, right? We're trying to separate these out from each other. Yeah. Why is that useful, fella? And let me ask Shari as well. Why is it useful to separate them out? What does it do? How does it help us?
Because there are matching questions and short sentences questions, and we need to know the question from which text.
Yeah, so I need to know which text to
Answer.
go.
Yes.
Right, so I'm trying to separate these out. How does that save me time, fella? Why is that actually going to save me time? Or anyone? Why does this separating them out
Because
save time?
When we are looking for an answer, we don't have to go to the all 4 texts.
Yeah, right.
Maximum of 2 we can check.
We want to do, yeah, exactly. We don't want to be reading more than 2 texts per question, right? Imagine you had to read 4 of these texts for each question. 1, 2, 3, 4. What would happen in the exam?
We don't have enough time.
You don't finish. Yeah. And that's what happened to me the first time I did OET reading, when I did my mock test, when I was doing my training. I didn't finish because I didn't analyze the text correctly. Okay. We're trying to separate these things out. We're trying to differentiate them. Okay. Now I want to talk a little bit more about this. I'm going to say some more things about this. But does anyone have any questions so far? Are you all happy with this?
I have a question, Alan.
Yes, go on.
Is it a helpful idea to make a skim reading of the questions at the beginning, because have an idea for which one?
Yeah, well, it's a good question. That's a very good idea, you know, it's a very good idea. But There's 20 questions, so I don't know if it's going to, I mean, maybe, Share, maybe, but there's so many questions, it might not, it might just make you more stressed. You know what I mean?
Mhm.
You should try it. Try it and let me know if it improves your score. Okay. Okay, so we're going to talk about differentiating text today, and why today really I just want to practice doing this, right? Why is this one different from that one? You know what I mean? Now, what I want to say today is that just like many of the skills in OET, you differentiate automatically. We all differentiate all the time, don't we? I mean, look, it's just trivial. Look, what's the difference between these two?
Color.
Colors, right? It's not something you really have to be taught, right? But I want to sort of show you a picture, right? So let's have a look at this picture here. We would automatically differentiate these, wouldn't we? So someone give me example. Betul, how is number one different? How is this one different from all of these guys?
It's older.
Okay, so he's older. Is he older than? See, if that was your analysis, that would be bad analysis because look, maybe she's old.
Yeah,
So now you haven't differentiated.
Alopecia. He doesn't have enough.
He's bald. Is that what you're saying?
He's born
Yeah.
also.
Okay. Baldness. Okay, so baldness will be a differentiate. Okay, so how can we differentiate? Let me do another example of this before we start to be more systematic with this. Mia and Rajput, could you say hello?
Hello.
How is number two different? How can you differentiate number two? If I say he's a man, is that differentiating?
No,
No.
because that one is man. So
A little bit, but that one's also a man. Yeah. How can I differentiate him?
he
Ginger.
has hair on the face. And
Ginger.
Yeah. He has red
We
hair.
say he has a
Beard.
beard, or you can say he has facial hair, or he has red hair. Yeah. Also, what about ages?
He looks younger.
He
He's
is younger.
young, right? So look, when we differentiate, it's automatic, right? It is automatic. But there are different sort of ways to do it. You know what I mean? Again, if you could just mute your microphones, guys. But there are different ways of doing it. In this example, sorry, when we differentiate, it is automatic. But in this example, if I want to differentiate number two, right, from number one and number three, I can use age as a way to differentiate, right? That's like a way of doing it, okay? You guys, you were very interested in this. How were you differentiating here? You were talking about hair, right? Or hair color even, right? How else can we differentiate, guys, in this? What categories do we have?
Gender,
Gender, what does that mean, gender?
male or female.
Yeah, we could do it gender. There's other ways to there's so many different ways here. Can anyone see another way to differentiate?
Clothes color of the clothes.
Color of clothes, and there's one more. The nurses actually didn't see this one, but I realized there's one more. Look at me, guys.
Position.
What do we call that?
Expression.
Does anyone know the English word for that, with what you do with your arms? It's pose, posture, or posture's good.
Posture.
Yeah, posture. So we could say, well, two of them have a negative posture.
Yeah.
One of them has a sort of neutral posture, right? Okay, so I'm just trying to show you guys that you do this all the time, don't you? You see three people, and most human beings will differentiate them, but they can do it in different ways, okay? In OET, it's exactly the same. We're looking for ways to differentiate. We're looking for ways of doing it, right? So if I show you these three texts, for example, how can I differentiate them? What ways are there of differentiating? When I say way, I mean like different ways of thinking about it, right? Does anyone want to try and differentiate these texts? Tell me, how are they different?
Main ideas are different, Alan.
Okay, actually only for two of them. Which one has the main ideas?
First of all, it's a
Diabetes, yeah,
yes, and
and
hypertension.
Hypertension.
okay, but look, inject the insulin. Now, it's not exactly the same, but it's getting a bit closer now, isn't it? It's not differentiating very much. So yeah, we can differentiate in terms of main ideas, guys, can't we, for texts like this? One of them is about hypertension. One of them is about diabetes. How else can I differentiate the texts? What do I always say?
Function.
If two of them are quite similar, like these two, I can look at functions. What's the function of this one?
Information.
Information.
Why was it written? It was written to give information. Yeah, information. What about this one? What's the function of this?
Instruction.
Instruction.
It's instructions, right? Why was it written? To give instructions. Okay, we're going to practice this a bit more today, and I'll talk a bit more about this. Is there any other way that I can differentiate these texts?
Keynote.
Keywords.
What we call keywords. Should be. So can anyone find me a key word here that would differentiate this text from the other texts?
Hypertension.
Blood sugar, arteries.
Arteries. I'll go with arteries here. Why did you choose arteries? I like that.
Block it.
Guys, why is arteries a good keyword here?
Bracket.
It's yearning.
It's in brackets, right? What do I always say in classes? I say it stands out.
Stands out.
What does that mean, stand out? To stand out?
Yeah, we can see instant.
You see it instantly, right? So maybe OET will ask me a question about arteries, right? And I have my keywords. Or maybe the question will be like, what is hypertension? That would be the main idea, right? So I can go to main. Maybe it's going to say, where do I find some instructions on a task? What text is that? I'm going to go here, right? So this is the idea, guys. These are just different ways of differentiating texts. Just like in this situation when we have all these different ways of differentiating people. Now, what I'm saying to you guys is in the exam is, I'm not saying that you have to always differentiate with age. You know what I mean? I'm not saying that you have to always differentiate with main idea. You differentiate in any way you can. Does that make sense? How much time do we have to differentiate texts, to analyze?
2
We
minutes.
only have, how long? 2 minutes in total. So it's 4 texts. How much time do we have?
30 seconds.
30 seconds for each text. Which is the one that's, now this is Farid, you were saying to me, and I agree with you 100%, Farid, which is the one that's the easiest to do, guys? Quickest to do?
Main idea.
Do we all agree that this is usually the easiest?
Yes.
Yeah?
Yes, yes.
And what I say to you guys is great, focus on this then. Just do function when you can, okay? Keywords, is that easy? Is it tricky? Do it when you can, okay?
I think it's
Could be, but we need more time.
Yeah, but I'm going to show you, let me show you a quick problem with this idea though. That is it. So Farid, main idea is usually the easiest, yeah? But what about this? What's the main idea of that text? It's much easier to get the function.
Yeah.
What's the function?
classification.
Classification, okay? But the topic is
Acne.
acne types of spots, right? You're going to see this very often where you're not actually sure. What's the main idea here? Come on, 5, 4,
Information.
3, 2.
Definition.
What's the main idea? It's not
Okay.
always that clear, right?
Information.
But sometimes it is very clear. What is it that makes the main idea very clear, guys? How do I know what the main idea is? Let me show you another example. Look at this one. What's the main idea here?
Paying criteria.
How do I know instantly that that's the main idea?
Because subheading.
Yeah, subheadings. Betul, whenever you see a subheading, you can say thank you, right? Because you know that's the main idea, okay?
Yeah.
But we're not always going to get them, so we need different ways to differentiate. We need to have different ways of thinking about it, all right? Now, What I'm going to do now, guys, is we're going to do a fairly easy one to start off with. Okay, we're going to do a small test, but the first one will be easy. Then the next two will be more difficult. Okay, so a test, fairly easy, I think. Is everyone ready for this? Let's call this not a test, we'll call this a demonstration. Okay. I'm going to show you text. You're going to analyze them really quickly, and then we're going to answer 7 questions. Ready?
Let's go.
Yeah. Okay. So here we go. So how much time do I have in the exam per text?
1 hour. For the
Per text,
for
per
the
analysis?
For the part
30
A.
seconds.
30 seconds. Ready? So why don't I just time you? Right. I'll just time you guys. Ready? 3, 2, 1. You see that in the text. Go. Okay. Function is easy. What's the main idea? What would you write down here? You've got 25. You've got 25 seconds. Just think. Just 25 seconds. And then I'm going to choose one person to tell me what the main idea is. Also, keywords, right? Are there any specific words here that you think are worth underlining? Right? 5, 4, 3, 2, 1. Okay, so that's what it feels like in the exam. That's how much time you have. Now, for me, let me ask Muataz, what's the main idea of this?
It's talking about the types of acne.
Yeah, well, see, the thing is, the types, that's more like classification.
Yeah.
That's the function of the text. But what is the actual main idea? What's it about?
Informative about acne.
It's acne what?
Reasons, maybe.
Spots, right? Acne spots, different types of spots. Okay. Now, in terms of keywords, what am I looking for with keywords? Something that stands out. What would you choose?
Blackhead,
Muataz?
whitehead.
All types.
Now, should I underline all of these? One, is that useful to me?
No.
We
It's
don't
too
have
many.
to.
I'm not going to remember all of that. I should only underline 2 or 3 things. Numbers, drug names, conditions, things like that. Does anyone see anything here you would underline?
Benzoyl peroxide.
Benzoyl peroxide.
Yeah, I'd underline that. Good. What else? Maybe something here that you see is unusual. That's an unusual. That's jargon. Okay. What else? Maybe that's it. Just 2. Okay. So don't go crazy with keywords. Focus on the main idea. But if you can't get the main idea, go to function. Okay. Again, 30 seconds starting now. 30 seconds. What's the main idea? What's the purpose of the text? Like, why did someone write it? Okay. And is there any keywords? Numbers, medication, names, that kind of thing. Just be ready. If I say your name, I want you to analyze this text for me. All right. 5, 4, 3, 2, 1. Asya, could you say hello?
Hello.
Okay, so this is fairly easy, this one. So what's the main idea of this?
Dealing with acne.
Yeah, dealing with. Right,
Suggestion.
good. And what's the function? Suggestions? Guys, help her out. What's the function?
Information.
Instruction. Advice.
I think it's like advice here, isn't it? Right?
Advice.
Yeah. I'll give you some help with this, guys, in a minute. We'll talk more about the function in a second. And now, remember, I'm not going to write down keywords. I'm just going to underline maybe 2 or 3 things. What can I underline that's jumping out at you? Names, numbers, medications. What do you think?
Maybe self-esteem,
Why
About
self-esteem? Why does that jump out at you, Chari?
because it is a rare using word.
Maybe. Anything else?
Pharmacist.
Non-comedogenic.
That's what someone said in the last class. Pharmacist. I think that's a good one. Anything else? There's not much, is there? There's not much jumping out. Maybe this one. Right? That's a piece of jargon. But remember, with keywords, we don't know exactly. We're just guessing. So, Chari, if you want to do self-esteem, it's no big deal. But the key thing here is the main idea is dealing with acne and the function is advice. Okay. This one, 30 seconds starting now. Go. 30 seconds. Just be ready. If I say your name, you need to tell me what is going on. All right. 20 seconds left. What's the main idea here? Focus on that, but also start to think, why did someone write this? Is it classification, advice, something like that? 5, 4, 3, 2, 1. Okay, so I'm going to ask Abani, sir. Can you just give me the main idea here?
The cause of acne related to hormone.
So keep it short because we don't have much time. So acne
and hormone.
Acne, hormones. Okay, is he right, guys?
Yeah.
He's right, isn't it? Okay. When you're focusing on main idea, you're looking for repeated words, aren't you? If there's no heading, there's no subtitle here. How did he know that it was hormones? Look, hormone, hormone, hormone. Does anyone see any more use of this word, hormone? Hormonal,
Yes.
right? So it can be a bit difficult to find the main idea when there's no subheading, but you're looking for repeated words, okay? Function of this text, guys?
Information.
It's just info, isn't it? Okay,
Yeah.
so last one, 30 seconds. Here we go. And I'm going to challenge one of you to analyze this, starting now, 30 seconds. It's not so bad, is it? But these ones, I think, are not the most difficult texts. We're going to do some difficult ones shortly. All right. That was 30 seconds. That's what it feels like. So fella. And there's someone in the class called doctor. So
Yeah.
whoever's doctor's here. So fella, super quick.
Yeah.
Main idea, function, and give me 2 keywords as well.
So main idea, it's always about acne.
Can you differentiate a bit more? Acne and
Acne and age,
Yeah.
age and gender.
gender. Good. Function.
So age and gender. So function, it's like giving info and advice also, I think.
Well, this is the thing. So you can have more than one function, but I think it's mostly information, isn't
Information.
it? Where's the
Yeah.
advice?
So
Maybe
I think
small.
so. There is, for example, in the big patient, practitioner should remind patient that acne is very common.
Yeah, you're
And
right.
we have in the end also we have like we have treatment. We have antibiotics, retinoids, or DAPs.
Okay. So guys, if you're ever not sure, you can put down 2 if you want, but I would always go for the majority, right?
Because
The majority.
Seek medical
function.
treatment such as the prescription of antibiotics.
Okay. Now, guys, what about keywords? Sorry, fella, give me 2 keywords. I asked you, didn't I? 2 keywords.
Dapton and 95%.
Yeah, what's a good keyword, guys? Numbers, right? All this stuff would be good. Mid-20s, but don't go too crazy with it, right? Maybe 3 or 4 here. Okay, so that's the way that's a demonstration of how we would analyze the text. Now, if we've done a good analysis, the first 7 should be fairly easy, I think. In which text can you find information about details about different kinds of spots caused by acne?
A.
Right, we had spots there. If you hadn't had spots, then you wouldn't have had that, but also classification helps you. Percentages of males and females who get acne? Easy. What about this though? Patient advice for cysts.
A.
A and
Yeah, why is it A?
Twice for
but
cysts.
it's a type of spot.
Because I think cysts was there. You would have to check A and B though, right? Because this is also advice. But it's very easy, isn't it? That's my keyword. What am I going to do? Go and
Cysts, yeah.
scan like we were doing at the start of class, right? So let's just quickly scan A. Look, where's cysts? Find me the word before cysts. Here, right?
Yeah,
So I've got my answer.
A.
Easy, very quick, right? Okay, next one. The reasons why people sometimes have acne.
Could be C or
I think
D.
it's the D.
Or D.
I'm thinking C because we've got hormones.
C.
What else could it
C.
be? Is
C.
Nothing else is dealing with causes, is it? Only hormones is a cause. Okay, the answer is C.
Yes.
The different kinds of people who usually get acne.
D.
D.
D, ages, genders, right? How to prevent regarding cosmetics causing acne?
It's B.
B.
Yeah, why is that?
It's
How to
dealing and
Techniques.
prevent.
Because it's dealing with it, isn't it? It's
Dealing with,
dealing with
yeah.
the causes, dealing with. That's preventing. Dealing with, preventing is a very, very similar idea. Last one, changes in skin's glands or skin glands.
C.
Because,
It's
The
hormone.
hormone.
Hormones.
okay.
Yes.
So think of that as a slower, I'm just sort of modeling to you how this should go in the exam, but it's going to get a bit harder, okay? But before I give you the two more difficult ones, I just want to go into this idea again of main ideas, functions, keywords, okay? I think the best way to teach people about this is just to show them examples. Just seeing examples, you'll go, okay, right? Give me examples of common main ideas that we always see, guys. We always see things like, what do we always see here?
Condition.
Treatment, conditions. To be honest, they're often all conditions, right? It might be acne is a condition, right? They're all about that. Treatment, assessment, guys.
Definition.
That would be a function. Okay, I'll talk about that in a second.
Medications.
Medications is it? Medications, good. What else?
Management.
Management,
Treatment the same.
treatment, management, almost the same. What else? That's the same as dealing with, right?
Indications and contraindications.
Indications, there we go, sir. Contraindications, what else?
Equipments.
It might be about equipment. Yeah, that's uncountable, Idil. So no S, so equipment. Anything else, guys?
Diagnosis.
Might be about diagnosis, right?
Risks.
So just to be clear though, guys, this is talking about what is a main idea? It answers the question, what is the text?
Speaking.
What goes here, guys? What is the text
About.
about, right? If I said to you, hey, what is this text about? And you say, oh, it's about treatment for cancer. That makes sense, right?
Yeah.
That's different from function. If I said, what's this text about? And you said, oh, it's about definitions. That doesn't make sense. It's definition of what? Definition of some kind of condition, acne or something like that, right? That's the main idea. Functions answer the question, functions answer a different question. The question is, why did someone write this? Does that make sense?
Yes.
So definition is to, if I don't know what something is, right? So fella, OET speaking, ready? Doctor, what is myocardial infarction? She's going to give me a definition now, isn't she? Right?
Yeah, would you like to? Mhm.
So this is what we're talking about with functions. Let me give you another example. Example of a function, guys. Advice, guidelines. Why do people write advice? Fella, why do, yeah.
Yeah, to help the reader to know what to do and what not to do.
This tells me what to do. Yeah, good. Whereas a definition tells me what something is. Like, what is a horse? Oh, a horse is an animal with 4 legs, right? Give me other functions, guys, that you know. Definition, advice, what else?
Classification.
Classification, instructions, what else?
History.
History might be history of cancer treatment, right? History of testing. You see how functions can apply to any main idea here. Good. Anything else? I think that's most, there's not very many, okay? It's usually one of those. Okay, keywords. Give me an example of a keyword. It could be anything.
Yes, a number, a specific medication.
Oh yeah, what are we looking for? Let's talk about that. What are we looking for here, guys?
Numbers.
Numbers,
Percentage.
percentages, what else? You tell me, guys, everyone, numbers, percentages.
Gender.
Education.
Words in brackets.
Medications, conditions, like scientific names, right?
Words in bracket.
Brackets. What does brackets mean, Albani? These ones,
Brackets.
right?
Yes.
Or these ones are also brackets, and also these ones. Yeah, anything like that. Anything else? What makes something stand out to you as a key word?
Capital letter.
Yeah, like if it says, you know, don't feed, right? Then maybe maybe that's something you should underline. Okay. So does anyone want to ask me any questions about the differences here? We're going to practice this again, but does this make sense?
Makes sense.
One thing just to make this make a bit more sense. Let's take instructions, right? Can I have instructions for using equipment?
Yes.
Yeah.
Yes.
Can I have instructions for assessment?
Yes.
Yes.
Can I have instructions for treatment?
Yes.
Yeah.
Can I have treatment for instructions?
No.
No.
Doesn't make sense, right? This is a function. It's what it's doing to the reader. Now, Fareed, you said to me before class that function's a bit tough. Yeah, you there, Fareed? Well, I
Hello,
was
yes,
chatting with him.
yes.
Yeah. Now, firstly, there's two answers to that, Fareed. First is you should practice this and improve this, and you'll find that your scores will improve. Okay. But something I've realized recently, guys, is main idea is the most important one. Okay, you should focus on this. Sometimes you will need to use this, but not always. But Fareed, when it comes to function, if I made this more simple for you, maybe it would be useful for you, Fareed. Okay, so just for now, there's really two different types of functions, guys. A big distinction is this: advice or information. Those two things are very different. I'll take this away for now. Fareed, you should be able to make that distinction quickly for any text.
Okay.
Right?
Okay. Got it. Yes.
Let me help you out though. Let me help you out. Why? How do we know something is advice?
Well, advice is always describing something. This is give you like criteria or classification. These.
Not so much, actually. No. See, that's the thing. That's not what we're focusing on there, Fareed. You focus on word like should. Remember what fella said? Should.
Okay.
Must. Guy, give me some modal verbs where it's like giving you advice.
Have to.
Have to. Anything else?
Avoid. It's important.
Well, these are all modal verbs. You should look out for the modal verbs, right? But you can also look out for what negatives, right? Things like
Avoid.
don't, yeah, avoid, never. Right? What else? Can anyone think of something like this? Not permitted, right? What else goes inside an advice text, guys? Think about it. If I say, buy me a coffee, what's that? Buy me a coffee. That's
Order.
It's an order, right?
Order.
What's the structure of this? We've got verb plus something. Do I normally start a sentence with a verb?
Yeah,
What does-
ensure. Yes, for example, ensure that.
But these are called, this is not a subject verb object, is it? Like, you know, Paul's always talking about the grammar subject verb object. Those are called descriptive sentences. But when I'm giving advice, I don't use descriptive sentences. I use imperatives. Right? What's an imperative? It starts with a verb. Right? So Fareed, look, let me give you something. If you see a text and it's like this, ensure he washes his hands, right? What's this first word here, Fareed? Ensure.
It's just look like imperative.
Yeah, because it's a verb, isn't it? Right?
Yes.
If I say, wash your hands.
Imperative.
Imperative. Do your homework.
Yeah, it is
Right.
imperative.
So guys, these are the kind of things we're going to see in advice texts. Everything else is usually a kind of information text, right? Think about this fella, and you guys, classification text. It's kind of like information, isn't it?
Yeah.
You know what I mean?
Yeah.
Classification, definition, these are all almost like different types of informative texts, aren't they? So what I'm saying, guys, is this. Today, when we practice, try to differentiate text using these 3 ways. But if you don't feel very confident about function, right, focus on advice or information. Does that make sense? These 2 you should be able to do quickly. I don't know about you, Fareed, do you feel like you can do this a bit quicker?
Now I can do something, yes.
Let's try it, right?
Yeah, it is nearly answer my concept. Yeah.
So this big distinction is just if you're struggling to do it within the time. Okay, one more time, guys. How much time? In fact, no, Batul and Muataz. How much time do I have to analyze the text in the exam?
30 seconds.
30 seconds. So should we try it? Should we try an experiment to see if you can do it in 30 seconds? Are you guys all ready?
Yeah.
Okay, so I'll get my watch ready. You're going to see now some text that you have never seen before. Oops, you can see the topic there. You're going to see some text that you have never seen before. And I'll be timing you. So it's a little bit of pressure, okay? If you want, you can write this down. Here we go. 5, 4, 3, 2, 1. Okay, 30 seconds. Okay, all of the texts are about sore throats, which I have. So go. Think about this. What's the main idea? What is it about? But also, what is the function? Why did someone write it? Why did they write it? Was it to give advice or was it to give information? Keywords, numbers, names, percentages, drug names. 5, 4, 3, 2, 1. So that's what it feels like in the exam, 30 seconds. I'm going to ask Chare if he's here.
Yes, I am here.
Give me the main idea and the function, please, Chare.
I think an approach of thought thread patients.
Well, almost, but you're focusing on the right part of the text, but it's not approach. Can anyone help him? You almost have to get the most important word here, don't we? Because we don't have a subtext.
It's dealing with a patient.
It's dealing with.
Management.
So here's something important for you, Chari. Whenever you see dealing with, that means management.
Management.
Right? So you guys, you can write down management or why not just write down dealing with? Right? It's the same meaning, more or less, manage. Okay. Okay, what's the function, Chari? What's this? Is this giving me advice or is it giving me information?
I think it's both of them.
Yeah.
Oh, interesting. But in what's the most, look, when we talk about the main idea, there can be more than one main idea here. It's not all just about dealing with, but we're just taking the general thing. I think this is in general. I think this is advice more than anything else. There might be a small amount of information, but remember, I'm trying to differentiate the texts. I can't have everything. I'm going to go for advice here, okay? Keywords, guys. Shout them out.
1 week.
Yeah, what else?
1 week.
Bacterial virus.
Yeah, brackets, good.
Yeah,
1 week.
Yeah, 1 week.
Any conditions here that we've missed?
Scarlet fever.
Scarlet fever, is that there? Ooh, good. Right, nice. Scarlet fever. Very good. Okay, let's move on. You've got 30 seconds to do the next one, starting now. Go, 30 seconds. What is the text about? What is the function? Is it advice or information?
Information, history.
Nice. Just hold on for 10 more seconds and I'll ask someone to give this to me. Five seconds, 4, 3, 2, 1. Rajput, what's this about?
History, information, you know, is giving me history first.
Yeah, but give me the main idea.
Yeah.
Acute sore throat assessment.
Fever pain criteria.
It's fever pain criteria. Now let me just stop here, guys. Look, what did I say at the start of the class? What do we call that?
Subheading.
The subheading. What does the subheading tell me?
Main idea.
Okay, so don't waste any more time. Just take it from here. Okay, that's the main idea. What's the function of this? Is it giving me advice?
Recommendations.
Information.
It's giving, if it's recommendation, it should be saying like, you should do this, you must do this, don't do that, never do this. Is it really saying that?
No, we recommend the use
It's
of this
information.
criteria.
Yeah, but that's just one time, Ibrahim. Just because it says it once doesn't mean that's the function of the text. Okay, you've got to see it throughout the text. This is just giving me information on the pain criteria. What are my key words? All this stuff, right? Yeah, 1, 2. Also, is there a condition here?
Streptococcus.
Yeah, so I would underline all of those guys. Okay. All right, again, 30 seconds. Let's push on. So as fast as you can. You've got a subheading, so that shouldn't be difficult. Got 30 seconds. What's the function? What are the keywords? Have a bit of a read of it. Read 1 or 2 sentences if you want.
See instruction first.
Okay, 5, 4, 3, 2, 1. Let me ask Mirella. Just Mirella, give us the main idea and the function, please.
Main idea of antibiotics.
Antibiotics, what?
How to prescribe when.
So when
To
prescribe. Yeah. Good. Function.
It's classification by score.
Classify and information, or is that advice? Does anyone see any imperatives or never or should, must? I think it's classification. What do you all think?
Yeah.
Yes, I agree with her.
Also, maybe a bit of information as well. Info. Okay, what's the key words, guys? Keywords.
Scoring of fever pain.
That's part.
Yeah, well, 1 week. 1 week.
16 hours.
16 hours. What else? Someone was saying scoring. Do you really want scores?
I mean 0 to 1, 2, 3, 4 to 5.
I guess so, but now these two are not very differentiated, are they? But maybe I need to do that anyway. Okay. All right. Good points. It has to be super fast, guys. So let's move on. So D, 30 seconds starting now. You've got a main idea because you have a subheading. So just take the keywords from that. Think about, is this advice or is this information only? Look at what do we call this, Batul? These are called
Footnotes.
Footnotes. So they always hide answers in the footnotes, right? So you should read those. 5, 4, 3, 2, 1, stop. Who wants to analyze this text? Mia, could you put your microphone on?
Yes, hello.
Okay, so I want the function, and give me the main idea first. That's the most important. Then the function. What's the main idea?
The main idea, antibiotics for adults.
So you could, why not just put 18 plus? Yeah, same idea. Very good. Function?
Function guideline.
What do we think, guys? What if it was guidelines, right? You would see here, you would see should, wouldn't you?
Yes.
Or must. Or you would see avoid or never. Right? Do you see that?
No.
No.
So it's not telling me that in that sense. Okay. So I'm just going to say it's information. Obviously, you should give the correct amounts. It's dosage as well, guys, isn't it? So I might write down dosage. Does everyone agree with that? Dosage?
Yeah.
Maybe time as well. What, for 5 days? Schedule. Okay, keywords. What am I going to write down for keywords?
Medication, erythromycin.
Pregnancy.
Yeah, all of these ones, right?
10-day
course.
Don't let OET fool you in the exam because they're going to hide their answers here, aren't they, very often, okay? Okay, so you underline no more than 2 or 3 usually, okay? Don't go crazy with keywords, otherwise it's too much for you to to help you differentiate the texts. All right, so let's see if we can do these quickly now. Okay, number one. When antibiotic, so in which text will you find information about when antibiotic treatment will be beneficial? Guys?
C.
C, says Morella. Why is she saying C? Because?
When
to prescribe.
When. So now we've got that answer from the main idea. Right, good. Okay, 2, how to assess the level of pain for a sore throat?
Assessment B.
One.
B.
Fever pain
B,
criteria. Good,
yeah.
good. The best type of antibiotics for non-minors?
It's
D.
D. Adult.
What is a minor in the UK? I looked this up today.
Under 18.
Below
Under 18, officially under 18, yeah. Which is silly because you can join the army at 16, so I don't know how that makes sense. Guidance to give patients about this condition.
advice A.
A.
Guidance to give patients advice, right? When to reassess the condition of the patient. When to reassess the condition.
A.
Ooh, that's a tricky one.
I think it's A.
What do we do when we're not sure?
Because
about
let's
the text?
reassess this.
Check.
Get it down to 2 and just scan. So this is talking about reassessment. So what could it be?
Yeah.
Where would I reassess? That's assessment, isn't it?
Yeah.
B. Is there any more assessment?
A.
That's dealing with management. Maybe A or B. Okay, what are my key words?
Condition.
Reassess condition. Reassess condition, right? And you would go and you would scan and you would find the answer. Okay, I'm not going to do it now because I want to move on. Okay. 6, prescriptions for pregnant women.
D.
D.
D. Easy, right? And we got that from keywords
Yeah, woman.
in the footnotes. 7, the things that medical practitioners should be aware of. Now, could be in more than one.
A.
A.
Maybe A.
Yes.
Maybe
C.
medical practitioners aware of. Maybe C, yeah, because it's like what you should know about information for.
No.
Okay, so what's my keyword here that I'm going to scan on?
Be aware
Medical
of.
practitioner.
Aware of. Can anyone think of a synonym of aware of?
No.
No.
Aware of, to know,
Consider.
Be cautious about.
cautious about, be aware of. Yeah, good. Cautious
in
about,
mind.
to know
Keep in
about,
mind.
to keep in mind. Okay, so we'll start with A and then we'll go to C. So A, can anyone scan and see
Yeah.
something saying keep in mind, be aware, something like that?
Be aware that.
Okay, there we go. Answer is A, right? So the first 7, you should be able to do them quite quickly if you have good analysis, okay? Obviously, the analysis is hard and the questions are hard too, right? It's the OET exam. It's not an easy exam, okay? Let's try again. Ready? This one's also hard texts. You've never seen them before. Ready? This time, I'm not going to write anything down on the screen. So guys, if you want to write down yourself on paper, you can, but there's no help now, okay? Here we go. 3, 2, 1, 30 seconds starts now. Focus on subheadings. You can just take one word, right? Or 2 words from the subheadings. Farid, is this information or advice? Do you see lots of modal verbs, guys? Lots of imperatives? I don't really. Yeah. Okay, so that's 25 seconds. 3, 2, 1. Who would like to tell me about this text? What's the main ideas here? 2 main ideas.
Malignant jaw tumor and benign jaw tumor.
Pronunciation of this, how do we say this word?
Benign.
Benign.
Benign. Okay.
Like the word, like 9. Yeah, benign. Okay, so function.
Definition.
Information given.
It's informative. The text is informative. It's not really telling me to do anything. It's got these 2 main ideas, malignant or benign. Obviously, everything is about tumors. They're all about that. So it doesn't help me to differentiate. Okay. Next one. Oh, sorry, keywords. Does anyone see something that might, there are some. Does anyone see any good ones? Yeah, this thing. Anything like, you're almost looking for
soap bubbling. Sub-body. Sub-body.
Yeah, why
maybe.
that one?
It's not
Maybe.
medical.
You're looking for something unique, aren't you, that would help you to differentiate the texts. Okay, you're guessing a little bit with this. Okay, 30 seconds starting now. Again, the main idea is really easy, right? But can you do better analysis than that? 30 seconds only. Got 20 seconds left. 2, 1, no, 10 seconds left. Okay, Asya, that's been 30 seconds. Tell me, what's the main idea here? Just one word, please.
Symptoms.
Symptoms.
Symptoms. Okay, symptoms. Sorry, not one word. Symptoms of this. Yeah.
So,
So you should write that down here, right? Function of this text, guys.
information.
It's
Information.
informative. I don't see any modal verbs or imperatives or, okay, so information, symptoms of, what is it? Mycetoma? Mycetoma?
Yeah.
Okay. Keywords?
Club shaped.
Yeah, there we go.
Club
That's something
shape.
unusual. Okay.
Ferrosanguinea.
That'll do. Maybe
White or black.
sometimes contrasting things are good. Up and down, left, white, black, strong, weak. Okay. Next one, part C. You've got 30 seconds. 5, 4, 3, 2, 1. Go. No subheadings here. So what is the main idea? You need to spend a bit more time on the main idea. But the function is easy, right? The function is,
Classification.
yeah. So at least I know it's classification of, that would be the main idea. What is it classification of?
Neurologic problem.
Yeah, some kind of problem. Yeah. Would you say neurological problem?
Yeah, because that's
Yes.
all about neurology.
Condition, problem or condition. Yeah. The jaw condition, something like that. And it could be many things. Okay, that's 30 seconds. Morella, what would you have here as main idea?
Neurologic problem,
Neurological problem and function
like classification.
and keywords.
Oh, Babinski,
Yeah.
myopathies,
Yeah.
Good.
all the
Good.
all the words in the brackets.
It's a lot of brackets. Don't go too crazy with brackets though, because you won't remember all of them. Just about 3, okay? All right, last one, guys. 30 seconds, and I'm going to ask one of you, and then you'll do the question starting now. Go. All right, that's what it feels like. Who wants to tell me? It's a strange one, this, because it's not as easy as you might think. Anyone want to tell me what the main ideas are here?
Evaluation of weakness.
Okay, so I'll
and
take that.
history.
Okay, so that's right. So evaluation means assessment, right? So evaluation, assessment of weakness. Okay, no problem. What does this mean now?
History, the signs and symptoms.
Information.
In what sense history? Is that the function of the text? No.
No, it's a sort of subtitle, not subtitle, but it's part and parcel of the previous one.
But you've got to understand what it means. It doesn't mean like the history of evaluation, does it?
Yeah.
No.
It's not like 100 years ago when we evaluated weakness, we did it like this. But now we have machines. It's not like that. It's history of asking patients for history.
Yeah.
Right? So you've got to understand that this is asking patients for history. Right? And what's the function of this?
Advice.
Advice.
Yeah, it is. Good, fella. It is. Look, it's just saying clinicians should. Right? Is needed. Right? Important. Very, very good. Okay, so if I show you these last questions, let's see how quickly you guys can get them. Because I thought these ones are fairly hard. Okay, they are quite hard, these ones. Let's see how well you do. You're just in the first 6 questions. So where do I find information on different jaw dysfunctions, Morella?
C.
A.
Oh, is it A or C? What do you think?
C.
I'll give you advice.
Neurological
No,
problem.
because on C
It's the
more.
classification. It's the classification text. Which one is that?
A.
I think it's A. Because
A.
jaw tumor on A.
Okay, so it could be A or
Distinction. Or C.
C, because that's also got different types, hasn't it?
Different type of
So-
neurological
So where do
problem.
I find information on different jaw dysfunctions? It's A or C. You're going to have to scan on that. Okay.
Just on A of jaw.
C.
Which one is telling me about different jaw dysfunctions?
C.
A.
I think
A.
it's C, isn't it?
C. Distinction.
No, this is
Just
no, weakness.
This is telling me about benign or not benign tumors.
Yeah.
That's
Yeah.
not a dysfunction, is it? Cancer's not a dysfunction in the normal sense, is it?
Dysfunction is C.
The answer is C. Okay. I made that question, Morella, so maybe you don't like it. Number 2, how to engage with patients past for assessment.
It's
D.
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 History.
Why is it D? Why is it D? Because
Because it's
history,
history.
right?
Yeah, history.
Right. Okay, but that doesn't obviously, that means something specifically. Details pertaining to the Babinski reflex.
C.
C.
E.
C.
Does anyone remember the key word?
C.
C.
Babinski.
C, wasn't it? And fella, you guessed that. Well done. Muscular wasting as a manifestation of the condition.
D.
D.
E.
Think about the meaning. What is
D.
muscular wasting? What is muscular wasting?
Symptoms. Signs and symptoms.
It's a symptom. Which one dealt with symptoms, guys?
B.
E.
It was text.
B.
Okay.
I'm not sure for this
Jaw
one.
tumors that are not dangerous.
A.
A.
Yeah.
Benign
What
tumors.
we call them benign. Yeah.
Benign.
How to distinguish muscular weakness from fatigue? I thought I'd do a hard one. How to distinguish muscular weakness from fatigue? What do you think?
Distinction.
C.
Check D or C.
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 Okay, so think about what was text D about? What was the main idea? What was it doing? What was it talking about?
Information.
I think it's D. D.
What was
C.
the main idea of D?
How to distinguish
Weakness is evidential.
Weaknesses, and what was the,
weakness?
not just weaknesses, it was
Yeah, weakness is D. D.
Evidence.
evaluation.
Evaluation.
So how to distinguish? I
D.
think it's going to be in D. Shall we just check? Maybe I'm wrong. Okay, so what's my key word here?
Weakness. Distinguish.
There's something more unique than that, fella. Very unique word.
Fatigue.
Fatigue.
Fatigue. Okay, so we're going to search in the text for fatigue, guys, and then we'll finish the class. Let me just zoom in. Sorry, sometimes this doesn't show very well. Sorry. Can anyone see this here?
Yes, we can see.
Yeah.
Fatigue?
From fatigue. Yeah. Evaluation of
What does it say?
It's on the first line.
weakness.
The first sentence.
Muscular weakness from fatigue.
There you go. Okay. All right, so I'm going to finish up there. So guys, remember, you need to practice this skill. There's different ways to separate out the text, but the main thing really to understand is that you're trying to differentiate the texts, right? That's what you're trying to do. Sorry, I'm dying here. The best way to do it is, what's the best way? Easiest, fastest way usually is?
Main idea.
Main idea.
Exactly.
Take sip of water.
But if that
Alan.
doesn't work, yeah, 1 second.
Alan, take sips of water if you have a cup of water.
Oh, thank you. Thank you. Good advice there. I'm with doctors, aren't I? I should have. You're probably going, Alan, let me prescribe you something. No, yeah, so main idea is best, but if not, you can go to function, right? It is useful. What did I say today? If you're really not confident about function, there's 2 big ones. What are they?
The main idea.
Advice and information.
Advice and information are very different. So you can usually make that determination. Okay. Last thing, keywords. What makes a good keyword, guys?
Unique.
Numbers. Unique. So numbers,
Yeah,
percentages.
Percentages, bold,
Yeah, all that
capital
stuff.
letter.
Yeah, you can see I'm crying from my
I'm
cough.
telling you, you need to stop talking.
You need-
You have to stop the class.
I'm
Read
going
your
to go.
break.
I'm going to finish. All right. Thank you very much, everyone. Have a lovely day. And I'll
Bye.
see you all soon. Paul is going to be doing at 3 p.m. What's he doing?
Speaking.
A speaking session. He's going to do like a course on speaking starting today at 3 p.m. See you later, guys. Have a lovely day.
Thank you.
Bye,
Take
everyone.
care, take care,
Hey, guys.
have a
Take care. Thank you,
nice
guys. Thanks for your concern. Bye-bye, guys. Bye-bye.